Programs for kids with intellectual and developmental disabilities are disappearing in Maine. In the past 2 months, 3 Spurwink residential treatment programs for kids have closed, 2 in Chelsea and 1 in Scarborough.
Now there are only 2 programs covered by MaineCare left in the state, leaving few options for many kids who are struggling. News 4 Maine's Katie Delaney joins us from our Bangor studio now with more on how these closures are impacting kids and their families. Katie?
Zach and Chris, amidst these closures, behavioral health professionals tell me over 100 kids in Maine are waiting to be placed in residential treatment programs but don't have anywhere to go. There are about 224 residential beds in Maine and 121 kids currently placed, but most facilities don't have the staff or resources to take on any more kids.
We wish that we could take them all in to provide them the support.
But staffing shortages and rising costs make it impossible. Rachel Bousquet runs one of the remaining 2 residential treatment facilities for kids with intellectual and developmental disabilities in Maine. At Kids Peace in Ellsworth, they've had an uptick in referrals since the recent closures.
The need is there, the need is present, and the longer that we wait, the more challenging it becomes.
Spurwink has one remaining facility open, the Brook House in Westbrook. Eric Meyer, the nonprofit's president, says the decision to close 3 of their programs is heartbreaking.
It was hard for the kids, for the families, for the staff.
Meyer says they decided to close their doors due to workforce shortages and financial struggles.
I'm not sure that there really are other viable options for many of those kids right now, and I do think that it's a huge challenge.
It's a real crisis in the state, and it's impacting our kids and their families.
Behavioral health professionals say there are more and more gaps in services for kids with developmental disabilities, especially as their needs become more acute, leading many to out-of-state care or being treated in hospital emergency rooms or inpatient programs.
The reason that's not good for them is that's the most restrictive level of care, right? And so, they don't necessarily have the freedom of movement they would have if they were at a residential facility.
But behavioral health professionals are working to prevent future closures from happening, making strides to bolster the workforce and work with the state to get more funding for these essential programs.
I am really hopeful.
Bousquet says Kids Peace is working to bring more professionals to the nonprofit to keep getting kids the services they need.
People here in Maine are very well known in the sense of always coming together, supporting their communities, and this is a challenge that I think we can overcome.
Kelly Barton, president of Maine Behavioral Health Care, tells me that healthcare reimbursement rates haven't kept up with the costs of delivering care, which is another reason many residential treatment facilities are struggling. She says addressing that gap in reimbursement is a long-term solution to getting kids the care they need. Zach and Chris.
Such an important issue. Katie Delaney live in our Bangor studio tonight. Thank you.